So my name is Nicole Harper. I am the System Director for Revenue Cycle Management here at St. Vincent Health. I got my bachelor's at IU in Health Information Administration, so I have a Registered Health Information Administrator certification. And then I decided, well, maybe it's time to do something different. So I ended up looking into expanding my background, so to speak, and got my master's in business administration. And then I decided one day when all this was said and done, I would love to teach. So I went back and got my doctorate in leadership and organizational development. Actually, I wanted to be a nurse. My mom is a nurse, my dad's in healthcare, so I really didn't have a plan B. I just knew that I was going to be a nurse. And I got to school, I got through about 3/4 of the semester and had to do an externship, and I had an experience with bodily fluid and blood and decided that maybe, just maybe, this wasn't for me. And so I went to my counselor. I loved healthcare, so I said, I don't want to lose all the ground that I've gained so far. I still want to stay in healthcare, but I don't want to do patient care. What options do you have? So my counselor introduced me to health information and gave me this really cool description and really talked it up, and I was super excited. And so I looked into it and ended up being here at IU, being able to satisfy my urge for healthcare, but not necessarily patient care. So it worked out. So health information management is important because ultimately health information management professionals are the stewards and the advocates for patient care. What we do is take all information that's provided in relation to a patient encounter, a physician office visit, a hospital visit, and we take that documentation, those words, and translate them into codes so that those codes can then be communicated between organizations, hospital, healthcare organizations, and insurance companies, or healthcare organizations and regulatory groups. So what happens is if any of that information isn't true, or if it isn't actually representative of the care that was provided, then the wrong information gets to the wrong people. So from a health information management perspective, our ability to be able to collect, retrieve, store health information for patients is an integral part to just patients being successful. I've seen several health information management professionals as expert witnesses in cases, pharmaceutical sales. I mean, you name it, we can enter into almost any industry with this background and help people, help advocate on patients' behalf. Is such an amazing area to study, because when I first started, I thought I was only going to be a coder. I didn't really understand the wealth of opportunity that was out there to take this information, to take this learning and apply it in insurance field, apply it in the law field. I never even thought that was an opportunity. And as a result, I got a chance to experience so many different environments, hospital, physician offices, several different things that I never really thought possible as a result of this particular degree. Informatics is an important area for students to study because it's literally the window to the future. There's so much being done, so many decisions that are being made now using data or as a result of data. And I'm sure that before, the same situation existed, but now when you're talking about the movement, the healthcare reform, everything is shifting to electronic exchanges, information exchanges. And so being able to manage that information, house that information, reproduce that information is integral to how we'll be successful across the continuum. So health informatics is definitely at the crux of that opportunity. So if I knew of a student who was looking into health information as a career choice, I would say get ready for an awesome journey. I have been completely pleased with the opportunities I've been afforded as a result of this degree. I have experienced and had more doors opened than I ever could have imagined just as a result of this work, because it does touch and cross so many different areas of specialty and just different professional areas. And so I'm more and more excited every day about my role. just because there's still so much opportunity. The sky is truly the limit. You have everything right at your feet. What you choose to do with it is up to you, but it's definitely an area that will afford you the opportunity to explore and achieve far beyond your imagination.